Hey everyone, and welcome. Today we are talking about a huge shift in healthcare. It's a new mission, really, getting outside the clinic walls to build healthier communities from the ground up.
So let me start with a question for you. What if the most important thing for your patient's health isn't something you can prescribe? What if it has nothing to do with the actual health care you provide? It's a pretty radical thought, right? It forces us to look beyond our treatments and our exams and into the communities where our patients actually live their lives.
And look, this isn't just some abstract idea. It's becoming a mainstream belief. This quote says it all. The community itself has a bigger impact on a person's health than the treatment we can provide. That is a massive realization, and it's pushing healthcare into a whole new arena, the world of community development.
So yeah, welcome to healthcare's new frontier. And to be honest, it's a place where very few healthcare organizations have really ventured before. But it's where the real potential is to make a lasting difference in health outcomes. The old way of just focusing on what happens inside your own building, it's just not cutting it anymore.
And this right here, this is the number that changes everything. Medical care alone is not enough. Get this, 4 out of the 5 big factors that determine if someone is healthy or not happen outside a clinic's walls. They happen in the community. This means that healthcare is now being called to join a fight that, community organizers and local leaders have been fighting for a long, long time.
So if you're going to join that fight, you have to understand the battlefield. And that means we need to talk about something called the social determinants of health, or SDOH for short. These are basically all the conditions in the places where people live, learn, work, and play that affect their health. This chart breaks it all down for us. There are 5 main categories, and what's wild is that the part we usually think of as healthcare is just one slice of a much, much bigger pie. So let's quickly run through what these other absolutely critical pieces are.
Okay, first up, economic stability. This one's huge. I mean, think about it. If someone's struggling with poverty, or doesn't have a steady job, or is worried about getting evicted, how are they supposed to focus on their health? It's just not going to happen.
Then you've got education. This is everything from early childhood learning to higher ed. It affects health literacy, like can a patient actually understand the instructions we give them? And it opens doors to better jobs, which, loops right back to economic stability.
And here's our slice, the one we know best, healthcare access and quality. This is about making sure people can actually get to a doctor and understand the care they receive. Super important, obviously. But as you can see, it is not the whole story, not even close. Next is the neighborhood and built environment. This covers safe housing, reliable transportation, how safe you feel walking down the street, and even if there are grocery stores with fresh food nearby. You've probably heard it before, but it's true. Your zip code can be more important than your genetic code. And last but not least, social and community context. This is all about the social fabric. Do people feel connected to their neighbors? Are they involved in their community? Do they face discrimination? Having strong social ties is a powerful protector of your health. So the big takeaway here is that all these things are woven together. You can't just pick one to fix. You need a real strategy. And the one we're looking at today is a really smart 2-front strategy. You engage the neighbors themselves, and you engage the partner organizations already working in the community. I love this way of thinking about it. You've got a ground game and an air game. The ground game is boots on the ground work with residents, helping them organize, training local leaders, and building a plan with them. The air game is about supporting the awesome organizations already in the community, strengthening them so they can have an even bigger impact. You need both to win. So let's zoom in on the ground game. It's a clear 3-step process. First, you help people organize into block clubs or neighborhood groups. Simple enough. Then you find natural leaders in that community and train them to be effective. And finally, you work with them to create a plan. The key is that the community drives the vision, not you. Now for the air game. And this is crucial. The goal isn't just to write checks and throw money at the problem. No, first you have to really get to know your nonprofit partners, what they're good at, where they struggle. Then you offer your expertise to help them get stronger. And only then, once they're really set up for success, do you make those big strategic investments. It's about building them up, not just bailing them out. Okay, so this all sounds great in theory, but where do you even begin? How do you actually put this into action? Well, let's break down the very first steps, your first mission, if you will. Here they are, 5 key actions to get started. First, and this is so important, pick one focused area. Don't try to boil the ocean. Concentrate your efforts to get real results.
Second, start building those grassroots partnerships we talked about. Third, strengthen your nonprofit partners before you give them a ton of money. Fourth, use data for everything, to guide what you do, to measure if it's working. And finally, step 5, once you've built trust and have a solid plan, then it's time to make those major investments.
So let's bring this all home. What's the path forward here? It's pretty clear that for healthcare to succeed in the future, it's going to require a whole new mindset and a commitment to working in a very different way.
So here it is, your new mission. You have to look beyond your 4 walls. You have to partner with the community, not dictate to them. You've got to start small and focused to get some wins and build momentum. Invest in capacity, not just cash. And ultimately, you need to be the one to lead the charge for a truly healthier community.
Which really leaves us with this final thought. Improving community health. It's going to happen. It's no longer a question of if it's necessary, but of who is going to step up and lead the way. Healthcare organizations are in a perfect position to be that leader. The only question left is, will it be you?